Hi there, everyone. Welcome to another episode of Talking with the Experts. My name is Kate Perkins. I'm an occupational therapist and founder of Cancer Rehabilitation and Lymphatic Solutions. I have the absolute privilege today of speaking to Denise Stewart. Denise is an occupational therapist with over 3 decades of experience working with breast cancer survivors during their recovery. And during this time, she's developed rehab treatments to suit breast cancer survivors. But she's also developed assessment methods to train health professionals who are new to this area of practice. And I can attest to that because I've done some of Denise's courses online and they are fantastic. And I use a lot of Denise's assessment methods and techniques in my practice. So we'll talk more about that. And she is also the founder of Courting Protocols Project and the Breast Cancer Rehab and Wellness Summit. So welcome, Denise. Thank you for your time.
Thanks, Kate. I am so excited to be talking to you, but more excited about sharing the message with more people.
Yes, it's my audience that I have spans across to patients or families of people going through cancer, health professionals who are treating in that space, GPs and specialists. So it's this discussion will relate to a lot of those that audience. So today I want to dive in to talking about recovering from the hidden scars of breast cancer. And that can mean the physical scars and also the emotional scars. But today, let's talk about the physical scars and what people can and can't see post breast cancer. So, so does the recovery of breast cancer happen as soon as the chemo or the radiotherapy finish?
Yes, it does, Kate. So the chemo is one of those things that just delays recovery because it's continuously trying to cut down the circulation to the problem area. So people find that while they're on chemo, it might feel like they're not recovering. And then after radiotherapy, again, it's kind of like another injury to the area. And so it does take some time for people to recover after the radiotherapy. And some people have a mixture of that. So they might do, chemo first and then radiotherapy, or some people do it around a different way. And so, from the surgery, there's all these different times of recovery. So recovery after the surgery, recovery after chemo, and recovery after radiotherapy. And at the end of that, people think, okay, now I'm going to get better. Now I'm going to get better. And it's the people that don't get better, or the things that don't get better, that I'm interested in looking at.
So there's a number of different types of scarring when you break it down. Can you tell us a little bit more about that?
Yep, I've called this the hidden scars, and that's because and let's just talk about the definition of hidden, because I actually went to the Google dictionary this morning, and I go, oh yeah, this is why they're hidden. And hidden is like kept out of sight. Hidden is covered, and hidden is not visible, and hidden is camouflaged. And so if we look at all of those words are what happens for the scars. And so what we see is there's the 2 scars usually, and so it'll be the one where they went in and took out the cancer, the tumor, and then the other one is where they take out the node, whether it be one node or many more than one node. And so people kind of think that that's it. So, that's the one that you see on the outside. But really, it's like the tip of the iceberg. And so where the hidden ones are where the doctor has been. and so where he's been in, and so they're so much deeper than where that surface scar is.
Absolutely. And so with your treatment, how do you assess those scars?
So what I did was I had to learn on the job, and so I had to use my hands to palpate, and so palpate and feel it, because you couldn't see it. You couldn't see it on the outside. And so then I went in and palpated and go, oh my goodness, that's so tight there. And I'd go to the other side and I go, well, that's what it feels like on that side, on the, the unaffected side, and come back and go, oh yes, that's so tight here, and it's tight in this direction. And so one was that I really got to learn palpation skills. And then I got a bit smarter and started using more of the arm positions. And so when you put the arm in a certain position, then you can see the deep scars. And so I developed a test to be able to put the arm in those positions so that you can feel it and see it. And then there are scars that are even deeper again that you can only feel it. And so I looked at those, the ways of feeling and seeing.
Okay, and those scars, if left untreated, they have a massive effect on a person's functionality. So their posture and their shoulder function and their breathing. So it's important to get those scars treated. What are your methods of treating those scars?
I have chosen the methods that are the easiest for my patient or the patient's partner to be able to use. So that's one. And so there was some criteria. And so I wanted it to be easy to do my treatment and for them to be learning while they're in the session. And then I also wanted a method that was rewarding. And I say that because when people were given exercises to do after their surgery, often people would come in and they'd kind of really guiltily, kind of like shamefully say, well, I didn't do my exercises because, and so they felt guilt about that. But it was more that they didn't do them because they couldn't see the benefit. And so they weren't getting any gains. And so because of that, seeing that, then I needed a method that people could straight away see gains. And so I was lucky enough to learn a method from Carl Levitt, who was a neurologist from Prague, and that method really fitted the bill. And so the method was for scar tissue and tight tissue. So that's the method that I use.
Okay. Do you find that cupping works? Is cupping a thing that you use?
Yep. So because I then knew that that tissue, it doesn't matter, how damaged it is, can always respond in some way. It doesn't respond 100% of the way ever. It always improves a little bit. And I was using it with my hands in a cross fashion or a down fashion. When we got introduced to cupping, which is really, only over the last couple of years, so it's just a new method, introduced probably by Elizabeth Josenhans from Germany in breast cancer care. It just made so much sense, because what I realized is that we could stretch in the horizontal ways, but how did we stretch in the directions away from the body?
Yes.
And so the cupping allows us to stretch up and stretch across. And so the cupping, which is, I have to say right now, is not the cupping method that you see on the Olympic sports people.
It's modern cupping methods?
It's an adapted cupping method. So let's just get that clear.
Yes.
And that and again, you know, like straight away, I just go for those listeners who think that they just go buy a cup. It is the location and the method is so important that you really need someone to help you, and so that kind of leads me to just talk about, just briefly, is that why do people need help? And that's because they can't feel it.
Yep.
And so people, after breast cancer, the surgery and the radiotherapy means that their sensation in this area is so poor. And so there's no intuition, there's no logic to being able to get a cup and then start using it. It is something that people need to be trained in. This is the location, and this is the direction, and this is the way that you go cupping.
Absolutely, because a lot of women I see have that numbness. They have that reduced feeling in certain areas. So yeah, most definitely getting treatment with cupping from someone who is trained and they know what they're doing. So do scars, are they heal? Do they have a normal healing response?
Yeah, I guess part of what your question is, from the people that are listening, they say, well, is it too late? If the scar is, 2 years, 5 years, or 10 years old. And so there is no timeline on when a scar can respond to stretch, the right stretch. And so that's at the furthest end. So I've treated people that are 10 years after, 5 years after, and there's always improvement with the stretch and then the arm movement. And I guess that's the most important thing, is linking arm movement to the scar. And then if we go back to the other end, which is the beginning end, can treatment be too early? And that the answer to that is yes. And so in the early phase of healing, so the scar is just kind of getting laid down and forming, which is normal. And if we put a stretch on that tissue in the very early stages, it's not ready for it. It's not strong enough. And so what happens is that it gets, it micro tears. And so then we get the body sends out that inflammation response, and then it lays down more scar. So it's really, really important that in the early phase of the scar, and let's just define early, something like 6 to 8 weeks, is that that we are quite gentle in the stretch, and that it's but it doesn't mean that we can't do anything. It just has to be very gentle. And then in the middle bit, let's just say between the 6 weeks and the 2 years, then the scar is continuously remodeling. And so it's really important at that stage is that we keep the stretch going in the right direction. And so again, it's about getting the arm stretching in the right way, the arm working in the right way, and then treatment at the scar in the right way.
So what are those conservative treatment methods that you would use?
Yeah, so what happens is that most women still to this day get given the walk up the wall exercises, and I don't use that, and I just think that is so frustrating for the person. So because that's in one direction only, and so I use arm stretch in different directions, and this is also incorporated in the exercise brochures that people might get. So when you see arm exercises in brochures, it's there for a reason. So it's to get the stretch in different directions. So I use arm stretch in different directions, and then I use hands-on treatment of the scar. and the hands-on being truly the hand or the cupping.
Yep.
And then the other thing that we haven't spoken about is that is just I help guide people in exercise selection and understanding, how they get back into their normal exercise.
Okay. And so talking about exercise, can breast cancer scars be treated like normal sporting injuries?
No, and I just go no because straight away you say that, I got this image of one of my patients that came to me after and she'd had a mastectomy and she'd had radiotherapy, and probably probably about 9 months after after her surgery, she'd had this problem, went off to a sports physio, and the sports physio really had no experience but knew what was required for sports people. And so her chest, her skin and her muscles were really tight.
Mm-hmm.
He used the same force that he would use for his sports people. And the lady came back to me, and it was something like 3 weeks after her treatment with that person, and that area was still bruised.
Wow.
And so that skin and that the muscles in the area, especially after radiotherapy, cannot handle the force that is used for sports injuries.
And talking about the scar tissue post radiotherapy, I want to talk a little bit more about that, because I see when I see patients, we're treating the build-up of fibrosis post-radiation, and that can come and go over an extended period of time. What sort of time frame do we look at post-radiation that continues to happen, that scar tissue continues to be laid down?
I would be saying 30 to 40 years. And so does that cover it?
Yeah.
But the research now, there's some research now, and it covers up to 9 years, but we haven't got researchers that have been there for 30 to 40 years.
Yeah.
But I have seen people come into the hospital with the signs of radiotherapy damage that appeared 30 years after their
Wow.
Yep. And so when you see something like that, it just makes me go, and what happened was, and I do have to share this, is that the person came in with a wrist that would just not lift up. Her fingers would not lift up. And so they decided then and there that there was no other reason for it, and so bar radiotherapy damage, and it was like one of those. I've had many moments where it's just made me go, work harder, Denise, work harder. And so that was one of those moments. I go, oh my God, I have to work hard to let people know that it's a long time. It's a long time. And so I would not want that on anybody, to have a wrist drop. And I'm not saying that everybody does, but the risk is something like every year after 5 years, every year after 5 years, then there's another couple of percent chance of having this brachial nerve damage. And it might be that the damage is just less feeling or less muscle action. The most serious damage is where the nerve just stops working altogether. And so I just go, I do not want anybody to be in that position. And so I just work on the radiotherapy scar tissue, which makes everything tight. And I would be thinking every year that people go to their therapist and ask them to soften up that area, because every year it just wants to get tight.
I have seen older patients where the fibrosis has just got that tight that there's a retraction in their breast, and their breast is much smaller than the other one. So, and being able to work with these women to soften that tissue up, they're just so grateful that that I had one lady say to me the other day, she lay down and she goes, it actually moved. Her breast moved and the breast tissue had softened up. So at what point should there be some education from where do women get this education besides us early, if we have these people early on in their treatment before they get to radiation? So I wanted to put it out there, who needs to be educating these women about what's going to happen afterwards.
Yeah. I think that I would love for the doctors to be able to say that treatment on their scar tissue requires ongoing care. And I would, that took me 10 seconds to say.
Yeah.
So if that was, like all they said, if all they said was go, find the right therapist to get the treatment, that would just be brilliant. And because why I say that is because, the doctors are held in such respect by these people, the surgeon, the oncologist, the radiotherapist. And so if they say nothing, then the person believes that nothing can be done. And so then they don't go looking. And so I think that the doctors, if they could say that 15-second sentence.
Not even.
Yeah, then that would be brilliant.
Yeah.
And then a backup by the breast care nurse is there are therapists that are trained to help manage tightness after surgery, radiotherapy, and chemo.
Absolutely.
That took 10 seconds too.
Yeah.
And so if we could just start really small and just open up that window of there is an option here, because at the moment what happens is that they're given the brochures, and the brochures just say do your arm exercises, and we're not talking about that at all. This is completely different.
And well, you need it all links in together. It's a holistic approach to what you do, what I do. There's exercise, and there's postural instructions, there's scar tissue management. There's a whole range of what we do to help treat our breast cancer patients.
Yep. Actually, Kate, I'm going to interject because I want to talk on that point.
Okay, great.
It's so important. And so at the 2-day workshop that I just ran over in Bunbury, we had a massage therapist, or lymphedema therapist. We had OT lymphedema therapist. We had physio lymphedema therapist. And so each came with their own focus. Each came with their own skills. Everybody has different skills that can all be important to the person. Then we also brought in the yoga therapist and the Nordic walking person, and we had the person speak to us about fatigue management. And so in the end, we had 22 therapists and these 3 other, and we had the mastectomy fitter, so the prosthesis fitter.
Yep.
And so now in one area, we have like 25, 26 people that know that each of them bring a slightly different skill. And so it's really important for us in the community to be trained, but also to network so that we can bring those best things to the patient.
A gold standard of care, and be able to provide them with all the opportunities.
Correct. That just gives me goosebumps, because that's what we want. It's not hard, but it does take training, and training about what everybody else does, and networking. It really isn't that hard, and would just make life so much better in the recovery phase for people after cancer.
Absolutely. Now, I want to talk about your other projects, Denise. I know I talked about earlier the courting protocols project. Can you tell us a little bit about that, please?
Yeah, well, that's from 2014 now, but it's still active. So it's on. Why I developed that was that courting was one of those things that's so unusual. It's not like a broken bone. It's not like a sports injury. And when the therapist got interested in providing treatment, then therapists across the world had their own method. And so what I did was I then collected real data about what they were doing and where they were doing it, and how many treatment sessions they would do. So, that is that's on YouTube. And if you put in courting protocols project. Or share courting protocols project, then you get to see amazing therapists from around the world showing you where their treatment was, what their treatment was, and how many sessions they did, and a before and an after photo. So that is a fabulous starting point.
And so I probably should have asked this question before that. So just for our listeners, can you explain simply, if possible, what is courting?
Courting is a tightness that is beyond what we normally know. And so it happens in the arm. When people reach up, then they feel it painful in their arm. Or if it's longer courting, then it's pain in their elbow or pain in their wrist. So courting is a tightness, and it took people a lot of time, a lot of time and research, and the researchers still haven't got there yet to know what the tightness is. But in simple terms, it's the tightness of the structures that we own. And it's tightness of the lymphatic vessels, and so knowing what that is and where that is then means that it helps in working out the correct treatment.
And just very quickly, I know there's a few different ways of treating that courting. Mm-hmm. What's the latest on how it should be treated? So I've heard that snapping a cord brings instant relief, but is there chances of damaging any other structures around that by doing?
Yes. So if we think common sense, a cord can be 1 millimeter wide, a cord can be 10 millimeters wide, or a cord can be 20 millimeters wide. And so when there is mention about snapping, then it just kind of makes you cringe at, if it was 10 millimeters or 20 millimeters, that's impossible. Impossible. And so popping or snapping can occur if it's a tiny cord with a stretch. So that's that thing, that point. The current method is that the insertion, or I'm going to say the reason for the cord, is because of an adhesion at the chest wall where the surgery was, and that treatment must occur at that location, which is the insertion point or the adhesion point, and that the treatment is all those treatments that we've spoken about before, because it actually is a scar.
So you have a poster on your website on how to assess for courting, and there's a self-assessment poster there as well.
Yep.
So can anyone get on your website and have a look at that? Or?
They can. So there is the poster which was put up from 2015, I think, was, where I actually developed that testing. And so it really clearly shows the methods that you go to, because the cording insertion is, if we just go back to the beginning of, like the topic of this, is hidden.
Yes.
It is so camouflaged. It is so invisible. It is so covered, and it is so out of sight. And so it is really important that people either go for training, or they simply go to the website and see how you can you put the arm in certain positions and stretch the skin so that you can not miss cording.
And again, I can attest that those assessment methods are fantastic. I use them with my patients. So it's well worth having a look. And I will put Denise's contact details and website up on this video, and with the details for the podcast. But just quickly, you can see Denise at www.breastandshoulder-rehab.com/about. So coming to an end, Denise, I just wanted to, you've got some new projects going on. So do you want to just give us a little bit of a rundown of what's exciting you at the moment, your new projects?
Oh, God, it's painful to be in my head, Kate. I can tell you, it's new all the time. So my new thinking for my patients is the assessment and treatment of axillary lymph node dissection using cupping. And then the other very exciting project is the workshops that I'm running, where we're building a network for the community. So those two things have just got me very excited.
Fantastic. And so for the practitioners that would like to come along to your workshops, can they find you at that same website?
Yeah, it's a simple email these days. Don't expect to get me by phone. I'm lousy on the phone. Just flick me an email, and then we can work out what's needed for you or your community.
Very exciting. I'm very excited for you and your patients and the practitioners, and I'll be continuing to follow you, Denise. So thank you so much for joining me today for this episode of Talking with the Experts. I've absolutely loved having you on, and I know for sure that you'll be a guest of mine again, because we'll be talking about your new project. So I'm very excited to hear what you have in store. So thank you, listeners and viewers. I hope you've enjoyed this episode, and I look forward to seeing you again soon. Bye for now.